Ever wonder why some patients relapse when they seem stable, or why mood swings can sabotage months and months of progress? The answer may start with brain chemicals. And today we're going to talk about serotonin specifically. I'm Dr. Arwen Podesta, functional integrative psychiatrist. I'm triple boarded in adult psychiatry, addiction medicine, and forensic psychiatry. Today, I'm going to get back to the basics and talk about serotonin, as it is necessary to pay attention to so you can change treatment outcomes. When we think about relapse, we often focus on external triggers, on stressful life events, toxic environments, difficult relationships, and on medication-assisted treatment, or treatment really, for sure. And those things are super important, but there's something that's happening inside the brain that's just as critical and often overlooked. Serotonin. Now, there are other key neurotransmitters at play for sure. Dopamine, definitely, the reward center, norepinephrine, the alarm clock, glutamate, and GABA balance. But for mood especially, serotonin is like the conductor of an orchestra, quietly making sure every section stays in rhythm. When that conductor is calm, the whole performance works in harmony. But if the conductor misses a beat or loses control entirely, the music is kind of turned to noise. And in recovery, that noise can look like intense mood reactivity, unshakable anxiety, powerful cravings that kind of seem to come out of nowhere. Now, here's the problem. If we don't address that invisible imbalance, it doesn't matter how motivated or supported the patient is, those cravings and mood crashes will keep pulling them back towards old patterns. And the worst part, most patients don't even realize this when it's happening. They think they are failing. They think they just can't cut it in recovery. But really, it's their brain chemistry that's just not at balance. It's not in harmony. It's quietly working against them. And if we as clinicians miss this piece, we risk missing one of the most important levers for preventing relapse. I've worked with a patient, I'll call her Jenna, who has been through some of the best treatment programs in the country multiple times. She was smart, motivated, strong family support. She understood the tools of recovery. And every time she completed a program, she came out optimistic, ready to rebuild her life. But then out of nowhere, something small, a stressful phone call, a sleepless night, even just a bad mood would send her right back into old habits. And at first glance, she seemed like she was getting derailed by life's ups and downs. But the pattern was too consistent to ignore. Each relapse happened when her mood dipped and her anxiety spiked, even if nothing major had happened externally. I got involved into looking at more than just her basics, but her habits, her neurochemistry. What we found was striking. Her serotonin system was clearly depleted and dysregulated. And it wasn't that Jenna didn't want to recover badly enough. Her brain's mood regulation simply didn't have the resources and structure it needed to help her hold the line. Once we started working on restoring serotonin balance, her mood stabilized, her cravings lost their edge, and she finally had the emotional bandwidth to use all the tools she'd learned in treatment. So what exactly is serotonin? Why does it hold so much power over a patient's ability to stay in recovery? Let's break it down. As you are well aware, serotonin is a neurotransmitter. It's one of the brain's many influential neurotransmitters. It's like an emotional thermostat. When serotonin levels are balanced, have good tone, the thermostat is set just right. Mood can be stable, sleep is restorative, people are resilient, emotional reactivity is manageable. But when the serotonin drops too low, or the system in general becomes dysregulated, the thermostat kind of malfunctions. Suddenly, small stressors feel overwhelming. Anxiety shoots up. Depression deepens. Emotional reactivity can hijack the mind before a person even realizes it's happening. Here's where it gets interesting. Serotonin isn't just in the brain. In fact, the majority of it is in the gut, which means that the food we eat, the state of our digestion, and the health of our microbiome can directly affect our mood and recovery resilience. On top of that, serotonin works through a whole network of receptors, kind of like different locks and key systems that open different doors in the nervous system. Some of those doors control mood, some sleep, and others influence how rewarding or tempting certain behaviors feel. In addiction, low or imbalanced serotonin can set the stage for a perfect storm. Increased sensitivity to stress, difficulty regulating emotions, and a heightened pull toward anything that promises a quick relief, whether it's a substance, a behavior, an old coping mechanism. And because these changes happen silently inside the body, patients often blame themselves for weakness or lack of willpower, when in reality, their neurochemistry is making the fight much harder than it needs to be. The good news is, this is a system we already know about and we can work with. Once we understand the mechanics of serotonin, we can use integrative evidence-based tools to help it function at its peak levels. And when serotonin is in balance, recovery becomes not just possible, but sustainable. So now that we've gotten reminded of what serotonin is and why it's such a critical player in recovery, the next question is, how do we actually work with it? Before I break it down, if you want to see more content like this, practical, evidence-based tools to help your clients engage deeply and recover more fully, go ahead and have a look at my master's class. It's designed specifically for addiction professionals who want to master tools that are evidence-based, that are integrative to increase engagement, improve outcomes, and reduce relapse. I'd love for you to join. You can find the link in the description. So how do we help our patients strengthen the system so they're not constantly battling mood crashes that may trigger cravings that set them up for relapse? The key is to focus on practical, sustainable interventions that can be layered right into a patient's existing recovery plan. This is not about throwing a dozen new tools at them or overhauling their entire lifestyle overnight. It's about finding the biggest lever or the lowest hanging fruit, ones that are backed by research and that patients can realistically stick with. Most importantly, starting to think about supplementation and maybe medication. So the first lever is targeted supplementation and maybe medication. Obviously appropriate and precise. Not every supplement and not every medicine is good or right for each patient. Know the mechanism of action of the medication and know what cycle you are working with. For some patients, adding 5-HTP, a serotonin precursor, can just upregulate serotonin production. For many with certain genetic factors that hinder methylation, methylation cofactors such as SAMe, activated folate, B6, B12, zinc, magnesium, those can all enhance all neurotransmitter production, including serotonin. Serotonergic medications such as SSRIs and SNRIs can be very powerful and potent, and knowing exactly how each medicine works for what patient is where you want to be. This is where clinicians' judgment, knowledge, and monitoring are essential. The integrative approach means tools don't replace therapy or recovery work, they enhance it. The second part is nutrition. Serotonin is made from tryptophan, which we get from food. Remember, tryptophan has to cross the blood-brain barrier, and once inside the brain, it goes through an enzyme, tryptophan hydroxylase, and that's the rate-limiting step to convert tryptophan to 5-HTP, which is then further converted to serotonin. Remember, tryptophan hydroxylase actually needs protein to function. So let's make sure we have the patient on good protein diet. Also, gut health is essential. As we know about the gut-brain axis, when we think of gut-repairing food, we think of fermented foods that are probiotic rich. This means a recovery-friendly diet should include high protein diet, not high carb like some people have touted. For a patient, even small changes like swapping out a sugary or carby snack for a tryptophan rich one and a protein snack can start shifting chemistry in their favor for serotonin balance. 3 is movement and mindfulness. Aerobic exercise has been shown to increase serotonin release. Mindful practices, breathwork meditation, those actually improve the sensitivity of the serotonin receptors. And otherwise, you're not just producing more of the chemical, you're helping the brain respond better to it. You've seen patients who commit to even 10 minutes of intentional movement or mindfulness every single day, and they report more consistent and stable emotions and fewer cravings. I've already talked a little bit about the gut-brain axis, but we really can't ignore it. So part 4 is gut-brain axis. Since most of the serotonin is in the gut, supportive digestive health is foundational. That can mean increasing prebiotics like fiber intake, adding probiotics as supplements in fermented foods, and reducing inflammatory triggers like ultra-processed foods. I've worked with patients where addressing gut health alone actually brought noticeable improvements to mood and resilience. So when you layer and combine all these strategies, nutrition, movement, mindfulness, targeted and optimized medication support, gut health, you create an environment where serotonin can do its job. And when serotonin is doing its job in stable tone, in good resilience, the rest of the recovery plan works so much easier too. When serotonin is balanced, patients aren't just white-knuckling through their recovery. They're thinking more clearly. They're regulating their emotions with less effort. They're able to actually use the coping tools and support systems you've helped them put in place. In short, they're no longer fighting an uphill battle against their own brain chemistry, and that really changes everything. So if you want to improve recovery outcomes, boost patient engagement, reduce relapse, you can't afford to ignore serotonin. By making small, evidence-based adjustments, nutrition, movement, mindfulness, targeted medication support, and gut health, you're addressing one of the deepest roots of emotional stability and resilience. This is where integrative psychiatry shines. It connects the dots between brain chemistry, behavior, and sustainable recovery. But here's the thing, even if you get the serotonin support exactly right, there might be hidden flaws in your protocols that keep patients stuck in place without you even realizing it. And if you're not addressing those blind spots, the results will always be capped. And that's why I want you to watch my next video, Sober But Still Struggling. In it, I'll show you how to spot the subtle mistakes that sabotage progress and how to fix them before they derail months of hard work. Once you see them, you won't look at your treatment plans the same way again. So click on that video. Thanks for watching.